Welcome to Surrey Memorial Hospital. As an emergency response team member, either as a paramedic or a member of a local police force, this video is designed to introduce you to the critical care tower and explain access points and important processes as you enter the emergency department. The emergency department at Surrey Memorial Hospital is located in the new critical care tower and can be accessed directly from either King George Boulevard or 94A Avenue. Once on site, the main point of entrance for all ambulances is via the secured emergency department garage, accessible by a driveway on the north side of the building. Opening of the roll-up door is triggered by driving onto a vehicle detection loop just outside the door, and then turning on the ambulance's strobe lights. The door is fully open when the lights to the right of the entrance turn from red to green. Please do not drive into the garage until the door is fully open and the light has turned green. The roll-up door can also be opened by using the access pad to the left of the entrance. There are 6 parking spots in the garage. In order to ensure space for incoming ambulances, you may be required to move your ambulance once it has been offloaded, depending on congestion levels. There must always be an offload spot for incoming ambulances. Please ensure you move to the exterior overflow parking spaces once you've taken your patient inside. Once parked and offloaded, escort your patient through the emergency department entrance doors. The emergency department has a single point of entry from the garage and is clearly marked. The public walk-in entrance, however, has 2 separate points of entry, one for adult and one for pediatric patients. Please be aware that all patients who have experienced chemical exposure and require decontamination must be offloaded outside the garage entrance door, in the decontamination suite adjacent to the garage entrance. They must not be brought directly into the garage and emergency department. When transporting patients with chemical exposure, please follow the pre-notification procedure by calling hospital staff via the intercom outside the decontamination area when you arrive on the site. Police may enter the emergency department garage using the same procedures as ambulance personnel. Police are welcome to use the garage when they have concerns about the person they have in custody being hostile or uncontrollable. Police must ensure that their vehicle can be moved from the garage to exterior overflow parking if needed. There are 4 dedicated police parking stalls outside of the garage and more stalls out in front of the hospital. As a general rule, police should only bring patients in through the garage who are hostile, not controllable, or are exhibiting significant behavioral issues. Most commonly, police will access the emergency department via the public walk-in zone. There is a mental health and substance use zone inside the public walk-in zone to the right. Do not proceed directly into this unit without clinical direction and escort. All patients must be triaged first. Just inside the emergency department entrance is a transition room. This room is designed as a safe environment for emergency department staff to intervene and settle patients as required before they are transferred through the department. Patients must not be left unattended in this room. With pre-notification, emergency department staff will determine appropriate use of the transition room and direct ambulance and police personnel accordingly. If possible, prior to arriving at the emergency department, please pre-notify the triage RN of your arrival and ETA. This will enable the patient to be moved faster to a care zone. Information required for pre-notification is the patient's name, provincial health number, date of birth, presenting complaint, and ETA. To access the emergency department itself, enter the code into the keypad to the right of the door. Once inside, a triage RN will perform a quick assessment on the patient. Please be prepared to provide the RN with the appropriate information. Once the patient in your care or custody has been triaged, you will be directed to one of the zones within the emergency department. Exit from the garage is by way of another roll-up door at the opposite end of the garage. A vehicle detection loop in the floor of the garage will trigger the door to open once a vehicle drives over it. Lights to the right of the roll-up door will turn from red to green once the door is fully open. Do not drive out until the light is green. There are 5 ambulance overflow parking spots outside the garage. They are clearly marked. If pedestrian access is required back into the garage and emergency department area, use the pedestrian door adjacent to the vehicle exit door. This door is activated by a security access pad. For more information about the Surrey Memorial Hospital Critical Care Tower, and specifically emergency department access points and procedures, please speak with your manager or supervisor. Thank you for watching.